All right, ever wanted to be a medical detective? Well, today's your chance. We're going to put on our thinking caps and dive into two really puzzling medical mysteries. Let's see if we can piece together the clues and crack these cases. Ready? Let's get started.
So, you might be wondering, how do doctors even begin to solve these super complex puzzles? Well, it's this amazing mix of science, intuition, and just good old-fashioned detective work. And that's exactly what we're going to do. We'll walk through the whole process, step by step, with two fascinating real-life cases.
Okay, let's jump into our first case. We've got a 23-year-old guy whose world is, well, it's literally fading to black. His sight is disappearing. The stakes couldn't be higher, and you can just feel the clock ticking. So, what's going on here?
All right, let's look at the case file. Here are our first clues. He's young, only 23. The vision loss came on suddenly. But here are the two details that should make your detective senses tingle. One, it was painless. And two, it happened in sequence. First the left eye 6 months ago, and now the right. Painless and sequential. Lock those details away, they're so important.
Okay, so the investigation gets more intense. The eye exam, it confirms what he's feeling. He's got a central scotoma, which is basically a blind spot right in the middle of his vision. When they look inside his eye, they see some weird stuff going on. Leaky blood vessels, a swollen optic nerve. But then, bam, the genetic test hits. We've got a mitochondrial DNA mutation. That's a huge clue. And you know what's just as important? What they didn't find. The MRI of his brain and orbits, totally completely normal. Remember that.
So based on all the evidence we've collected, it's time to bring in the usual suspects. We've got our lineup right here. Any one of these could cause vision loss, right? But only one of them is going to fit all the facts of this case. So which one is it? Let's hold that thought. All right, let's switch gears to our second mystery. And this one is heartbreaking. It's about a little 7-year-old girl who's in a daily fight with these awful, uncontrollable seizures. And here, the puzzle isn't just figuring out what's wrong, it's finding the right way to help her. So when we open her case file, we see she's dealing with two different types of seizures. She has what are called atonic seizures, you might know them as drop attacks, where she just suddenly loses all muscle tone and collapses while she's awake. Then when she's asleep, she has tonic seizures, where her muscles go rigid. This specific combination, tonic and atonic, that's a really, really big clue for us. The investigation gives us more pieces of the puzzle. They do an EEG, that's the test that looks at brainwaves, and bingo. They find this very distinct pattern, generalized, slow, spike in wave discharges. Now, that's not just a bunch of medical jargon. It's not random static. It's like finding a signature at a crime scene. It points us in a very specific direction. So for this case, our suspects are a little different. They're not diseases, they're treatments. Based on everything we know, her unique seizure types, that signature EEG pattern, which of these medications is the right tool for the job? Which one should we add to her treatment plan to give her the best shot? Okay, we've laid out all the evidence for both cases. You've seen the clues, you've seen the suspects. Now, it's time to solve these things. And the secret sauce here, the real key, is the process of elimination. It's not just about pointing to the right answer, it's about proving why all the other answers are wrong. And the verdict for case number 1 is Leber's Hereditary Optic Neuropathy, also known as LHON. When you look at it, every single piece of the puzzle just clicks into place. So what is LHON? Well, look at this. It's a mitochondrial disorder that causes, wait for it, bilateral sequential vision loss, primarily in young men. Sound familiar? It's a textbook description of our patient, a young guy losing vision in one eye, then the other. That classic story, plus that bombshell genetic test finding, that seals the deal. Case closed. Okay, but let's do our due diligence. Why wasn't it optic neuritis? Remember that critical clue we flagged? Pain. Our patient's vision loss was painless. Optic neuritis, on the other hand, almost always hurts, a lot. So just based on that one single detail, we can confidently cross suspect number 1 off the list. And what about NAION? Well, this one's all about the patient's profile. NAION is something you see in a much older crowd. Our guy is 23. The age just doesn't fit. So while it's a possibility for vision loss in general, for this patient, it's a very, very unlikely culprit. And multiple sclerosis? This is where that clean MRI becomes our star witness. MS can definitely cause vision issues, absolutely. But you'd expect to see evidence on the brain scan, lesions, other changes. Our patient's MRI was spotless. It was totally normal. That clean MRI basically gives MS a rock-solid alibi. It couldn't have been there. All right, on to case number 2 for our 7-year-old girl who we now know has a complex condition called Lennox-Gastaut syndrome. The best adjunctive or add-on treatment is clobazam. And that word, adjunctive, is really key here. Lennox-Gastaut syndrome is notoriously incredibly tough to manage. One medication just usually doesn't cut it. It almost always takes a cocktail, a combination of drugs, to even begin to get a handle on the seizures.
So why not some of the other options? Let's take ethosuximide. It's a great drug, but think of it like a specialist. It's fantastic for one specific job, treating absent seizures. But our patient doesn't have those. She has tonic and atonic seizures. And for those, ethosuximide just isn't the right tool. It wouldn't do a thing to help her. Now this is so important, you guys. It's not just about picking a drug that might work. It's about actively avoiding ones that can cause harm. And some of these other drugs, like carbamazepine or phenytoin, can actually backfire. In a patient with Lennox-Gastaut, they can make those drop attacks, those atonic seizures, even worse. So choosing the wrong medicine isn't just ineffective, it can be dangerous. So there we have it. 2 cases, cracked. But let's zoom out for a second. Beyond just these 2 patients, what's the big takeaway? What does this teach us about how medical mysteries are solved? It really boils down to this elegant 3-step detective method. Step 1, gather your clues. That's the patient's story, the exam, all the tests. Step 2, line up the suspects. You create that list of possibilities. And then, the crucial step 3, eliminate and confirm. You meticulously rule out everything that doesn't fit until only one answer, the truth, is left standing. And that's really the heart of it, isn't it? The most crucial takeaway is that the process of elimination is just as important as the diagnosis itself. Knowing what something isn't, that can be just as powerful as knowing what it is. Every wrong answer you cross off the list is a giant leap toward the right one. And, this isn't just about medicine. This way of thinking applies to everything. In medicine and in life, what you rule out is often just as revealing as what you rule in. So next time you're facing a puzzle, ask yourself, not just what could this be, but also, what do I know for sure that this isn't? It might just lead you to the answer you've been looking for.